to turn off your phones, and I'm going to do the same, right? You have to practice what you preach. It is off. Okay. Thank you. We're starting. My phone rang. So good afternoon, and thank you for your patience. This is actually crossover, so we're very, busy, and we appreciate you being flexible, all of you, okay? This is the Health and Government Operations Committee. I'm Chairman Jocelyn Pena-Melnick, joined by my wonderful Vice Chair, Bonnie Collison. This is our first session back in person since 2020. So I ask for your patience if we encounter any technical or streaming issues, which will happen. Please take your electronic devices so you are not embarrassed like I was to vibrate, and don't hold any conversations in the committee room while the testimony is happening. If you need to do that, please go outside. As a reminder, there's no food or drink allowed in the gallery. What happens is that people eat and leave the garbage, and then staff has to clean it, and that's not kind because that's really not their job. We're going to hear from the bill sponsor and the bill sponsor's panel, followed by all in-person witnesses. So it will go as follows: favorable, favorable with amendment, and unfavorable. Then all virtual witnesses, the same. The bill sponsor testimony in this committee, usually I don't limit it, but don't take more than 5 minutes, please. While all witnesses will have 2 minutes to provide testimony, and I mean that, 2 minutes. When you see the timer go off, I'm not going to be rude and interrupt you, but I do ask you to complete your last thought, your last sentence. A timer is displayed on the screen, and you will hear it sound. Please, for our wonderful committee members who have been working so hard, this week and the entire session, adhere to our usual committee rules of 1 question and 1 answer from the panel, not 1 question and 1 answer from each witness. And please keep your question brief. Only 1 witness will be allowed to respond to the question. So I ask the sponsor to decide who is the best person on their panel to answer that question. Members and witnesses will have an opportunity to engage further discussion in subcommittee where we do all our work. Members of the public will be able to view this live stream on the website, Maryland General Assembly website and YouTube. Today, we'll hear the bills in the following order. And we're going to start with House Bill 1101. We're jointly assigned with the Health and Government Operations Committee and Appropriations. Can you please introduce yourselves?
Hi, good evening. I'm Delegate Emily Shetty. Thank you.
Good evening. I'm Delegate Alicia McCaskill.
Delegate Jim Heinbach. Thank you.
My pleasure. It's great to have you. And when I ask, are there questions, please let me know, okay? Because you're part of this process. And we're going to start with 1101, followed by 25, followed by 329, 958, 953, and the last bill of the day will be House Bill 1043. So let's start with House Bill 1101. Will you be so kind and bring your panel if you have one? How are you? Good afternoon.
I'm good. How are you?
Now.
Good evening.
Actually, that's right.
Thank you, Madam Chair, Madam Vice Chair, and esteemed members of Health and Government Operations. I think I'll present, and then I know there are other folks that want to speak, so I'll step aside and then let them speak. I am Delegate Weigel, pleased to present House Bill 1101, which would provide financial assistance to pregnancy centers, providing support to pregnant mothers in need. These support services include counseling, housing, health care, adoption services, material assistance, job training, and educational assistance. Nationwide, an estimated 2,700 pregnancy centers provide an estimated $267 million in services annually at no cost to their clients. These services do include free pregnancy tests, ultrasounds, STD testing, parenting and counseling support, free diapers, car seats, and clothing. House Bill 1101 has 3 objectives. 1, to create a grant program administered by the Department of Health or a coordinating agency. 2, establish a special non-lapsing fund funded by both the general fund and private contributions. And 3, create an income tax checkoff on the individual income tax return for private contributions to the Maternity Care Access Program Fund. The bill provides hope and potentially a fresh start to those who may only see desolation and despair. I ask for a favorable report on House Bill 1101 and be glad to answer any questions.
Thank you.
Thank you.
Are there any questions for the delegate? We do. We have first Delegate Riley.
Thank you, Madam Chair.
My pleasure.
Thank you, Delegate, for the bill and coming here to present. I'm sure you noticed your fiscal note, so it does have a fiscal note here in HGO.
Yes.
We look at that quite often because our bills are quite expensive generally. So with that saying, why do you think that it is still that, pressing forward with this bill, and what's the importance of it, even though it does have this large fiscal note and the importance of it at this time in the age? That we're
Well, the
living in?
fiscal note is actually negotiable because the bill sets the $3 million funding level. So if the committee is inclined to entertain the bill, I'm certainly receptive to that being reduced to a level of, say, 250 or 500,000, or set it up as a pilot project to see if that would work. And as I stated, the bill offers, I know that a lot of times there are single unwed mothers potentially who don't see any way out or an option. So this bill actually is very broad in the fund, so it could potentially create housing opportunities for folks. It could create educational opportunities for them, in addition to other financial support. So, yep.
Are there any other questions for the sponsor of the bill? Seeing none, thank you so much for being with us. We really
Thank you, Madam
appreciate
Chair.
you. My pleasure. Next, we have Deborah Brocato, Brian Barnwell, and Laura Bogley. Good evening. How are you?
Good evening. How are you? Okay, I guess I'll start. Okay, good evening, Madam Chair and committee members. I'm Deborah Brocato for the Campaign to Protect Women, and we strongly support House Bill 1101. The Maryland General Assembly has used its legislative powers to vastly expand taxpayer funding of abortion. Polls show that 81% of Americans would like public funds to also be used for health and planning services that save the lives of mothers and their children. With that in mind, Campaign to Protect Women asked the committee to remember all the pregnant women and girls in need who seek the support that pregnancy centers offer. I volunteered at a crisis pregnancy center in Baltimore County for over 8 years. The majority of the women traveled from the city and even had to take the bus to get there. The Pregnancy Center offered material support, pregnant and parenting education, and emotional support. The young ladies would schedule weekly appointments to learn about their developing baby and how to take care of themselves and their baby. For every visit, they received the material support of maternity clothes, diapers, baby clothes, and other items necessary for baby care. We developed relationships with those women and encouraged them as they progressed. The rent, the utilities, the material items, and the educational supplies were paid for by generous donations of caring Marylanders. If the state of Maryland can spend millions of dollars on abortion services every year, the Assembly can certainly find money to fund maternity care access. Maryland state government should not be one-sided when it comes to pregnant women and girls. Poor women and girls deserve the freedom to choose motherhood, and Marylanders expect their state government to support the right of motherhood. Campaign to Protect Women urges this committee to respect and protect a woman's right to motherhood. We strongly recommend that you give a favorable report on House Bill 1101.
Thank you. Next, please.
Brian Barn with the Maryland Catholic Conference. Pregnancy Support Resource Centers are the backbone of a sanctuary for life. They accompany and help women during their difficult times. They respond with love and provide help, resources, and direct assistance so mothers can choose life. In 2017, 29,800 abortions were provided in Maryland, which was a 7% increase in the abortion rate in Maryland between 2014 and 2017. Pregnancy support/resource centers are already helping and serving many women and children in our state. This bill would help these centers even more by allowing the state to receive contributions for these centers from taxpayers and other sources. This funding will allow the centers to help even more vulnerable women and children. Furthermore, as the bill will provide a dedicated funding source via the governor's budget, the Pregnancy Center Support Resource Centers would be able to help even more pregnant women and their children who are vulnerable. As a state, we need to help those mothers who make the choice to have and parent a child. Women deserve more options than abortion. This bill will help support pregnancy centers by allowing taxpayers the ability to donate to life-affirming causes. This bill will also help vulnerable women and children in need by providing that the government allocate funding for those women who choose life. For these reasons, the Maryland Catholic Conference asks for a favorable report on this bill. Thank you.
Thank you for your testimony.
Thank you.
And you used to be a legislator in New York, right?
Yes, that's true. Just recently.
Yeah. Thank you. Go ahead. Next, please.
Thank you, Madam Chair and committee members. I'm Laura Vogley, Executive Director of Maryland Right to Life. We strongly support this bill to dedicate public funds to ensure that women have greater access to quality maternity care in Maryland. We extend our appreciation to Delegate Weibel for introducing this important bill that will help to strengthen Maryland families. This bill is an opportunity for the Assembly to empower women of all socioeconomic groups to choose life for their children. As you've heard, 81% of people participating in the 2023 Marist poll favor laws that protect the lives of both mothers and their unborn children. Public opinion holds that funds should be prioritized for programs dedicated to improving maternal health and birth and delivery outcomes. While 21% of women fear they cannot afford to continue a pregnancy, pregnancy resource centers are an important part of the solution. They are model community-based nonprofit organizations that for more than 50 years have provided essential services for women, including care, counseling, and support before and after pregnancy. Medical pregnancy centers operate under the supervision of a licensed medical director in accordance with all applicable laws and carry medical liability coverage. These centers typically offer pregnancy testing, diagnostic ultrasounds, and testing for sexually transmitted diseases. They also provide parenting education and material support, as you've heard, including supplying diapers, baby clothes, and child safety seats. The impact of pregnancy centers is remarkable, serving millions of clients and providing services that are not otherwise provided by the state. It is important to note that in these centers, clients are served without regard to age, sex, race, income, nationality, religious affiliation, or disability. So for these reasons, we respectfully urge your favorable report on this legislative solution. Thank you.
Thank you very much. Are there any questions for this panel? Delegate Johnson.
Thank you, Madam Chair, and I'm just from my first time seeing this bill and going through it, so maybe, I don't know if you can answer it, anybody on the panel, or maybe a question for the sponsor. I see on page 3, one of the qualifications is in good standing in any state or jurisdiction in which the organization is registered or incorporated. So is there any opportunity for an entity to have these centers in multiple states and take Maryland state tax dollars and put them towards some of these centers that are not in Maryland?
Who's the best person to answer that question?
Probably
Only one
the sponsor. I'll defer to the
Okay.
sponsor.
Okay, thank you.
Ms. Delegate, thanks for the question. Obviously, we would not want to fund centers in other states, so if that needs to be clarified, I'm certainly amenable to an amendment for that. I don't want Maryland dollars going to any other state.
My pleasure. Any other question? Seeing none, thank you so much for being with us tonight. We really
Thank you.
appreciate it. Our pleasure. This actually concludes the bill hearing on House Bill 1101. Our colleagues from Appropriations had to go vote. Next, we have House Bill 25, Delegate Acevedo, Public Health Healthy Maryland Program Establishment. Good evening, Delegate Acevedo.
Good evening, Madam Chair. Good evening, members of the Health and Government Operations Committee. I know you all have quite a bit of bills today for the hearing, and this bill, House Bill 25, is a reintroduction. And so with that, I will just take 1 minute to just say and to provide some data. One, pre-pandemic, we had about 250,000 Marylanders who were uninsured, majority of whom were Black, Latino, low income, and with disability. Post-pandemic, we now have close to 500,000 people who are uninsured, also Black, Latino, low income, and people with disabilities. The reality of it is that Maryland is the only state that can implement a single-payer Medicare for All system where people are being covered and there is free health care at the point of service. And that is what this bill is hoping to accomplish, ensure that we're covering everyone regardless of socioeconomic status, regardless of zip code, income, who you love, where you live. We want to ensure that everyone is covered and that healthcare is free at the point of service, and that's exactly what this bill would do. And so I ask for a favorable report, and I thank you all so very much for your time because I know you have some other bills, and appreciate it. Thank you, Madam Chair.
Thank you. Are there any questions for this sponsor? Seeing none, thank you very much. And actually, that concludes the bill hearing on House Bill 25. Next, we have House Bill 329, Delegate Ruth, Public Health Commission on Universal Health Care. Madam Chair, may I bring my panel? Yes, absolutely. Oh, wait a second, there was, oh no, this is, there's a virtual witness for your bill.
Yes, ma'am.
Okay,
Thank you.
Thank you. Good afternoon.
Good afternoon, Madam Chair, members of the committee. For the record, I'm Delegate Sheila Ruth here supporting House Bill 329. First, I just want to say this bill is just a commission. It does not commit us to any kind of healthcare system. It's an issue that we need to be important to study because there are a lot of questions about it, and we want to make sure that we have the answers before we move forward. And first, I want to thank this committee because I know that over the years, this committee has done so much work to ensure that all Marylanders have health care, and I really, really appreciate that. But we're dealing with a complex system with many different moving parts, insurance companies and Medicare and Medicaid and the federal government, and all of that complexity adds to the cost, and it adds to the difficulty of making sure that everybody has health insurance and health care, and even some people who have health care can't afford to go to the doctor because they have high deductibles and high out-of-pocket costs. And there is plenty of, although there's plenty of evidence looking at other countries, and although there's no single-payer healthcare system that's been implemented in the United States, there's a lot of work that's been done in states and at the federal level that can be used as a groundwork for studying this issue. So this bill really just sets up a commission that is charged with looking at some of this other work in other states and developing a plan for how we could move forward with a single-payer system. I don't need to tell you the importance of making sure that everybody has health care. It's not only a moral and an ethical issue about leaving no one behind, but it's an economic issue because when people don't have adequate health care, they delay care, they get worse, they clog up the emergency rooms, they can't work, often leading to lower productivity, loss of income, loss of job, and premature death at the worst extreme. So just to list a few of the studies that have been done in other states, in 2021, Maine passed actually a single-payer health care bill, but it doesn't go into effect unless there are waivers that the federal government creates, and those are not they're not created at this point, but they actually have a Maine Center for Economic Policy Analysis, which shows cost savings for most individuals and employers, including state, local, and municipal governments, which provide health insurance currently, and their analysis would show cost savings for that. New York has a single-payer bill called the New York Health Act, which has passed the Assembly 4 times but hasn't yet passed the Senate. And they had a 2018 RAND Corporation assessment, which estimates that it would achieve the goal of greater health care coverage at equivalent or slightly lower overall cost, and that 90% of households would pay less under a single-payer plan. There's also an economic analysis in Washington State that estimates a plan there would generate $9 billion in annual savings. At the federal level, the Congressional Budget Office has done a study. I believe 3 out of the 4 scenarios they looked at saved money while providing greater health care. Of course, that's at the federal level, so it's not exactly equivalent, but it's something that could be looked at. And so with this, I ask for your favorable report. Thank you so much.
Thank you for your testimony. Next, please.
Thank you, Madam Chair and members of this committee for the opportunity to speak. So my name is Megan Outen. I'm a resident of Wicomico County. I'm also currently sitting on the Salisbury City Council, and I am here today to express my support for House Bill 329, which would establish a commission on universal health care here in Maryland. Since the COVID-19 pandemic, the disparities in our healthcare systems are more apparent now than ever. Rural communities and low-income households have felt the brunt of the pandemic's health and economic impacts. As a resident of Wicomico County, a rural county where nearly 14% of its residents exist in poverty, I have witnessed these impacts firsthand. Residents across the Lower Eastern Shore face daily challenges in order to access necessary healthcare services, resulting in many having to travel 4 to 5 hours round trip to visit Annapolis or Baltimore for the care they need. The cost then becomes more than the medical visit. It's the gas to get there, the food you need to eat along the way, and the potential hotel stay if you're receiving long care treatment, and more. These are costs that add up over time. And when over 45% of households on the Lower Eastern Shore are already struggling, the financial burden is too great. This is why it is more important now than ever to ensure that every Maryland resident has comprehensive health care, regardless of their income, race, gender, or geographic location. The Commission on Universal Health Care would be an important step towards achieving this goal. It would bring together stakeholders from across the state, including healthcare providers, insurers, policymakers, and advocates to identify a comprehensive plan for implementing universal health care here in Maryland. This bill will represent a chance to bring us more information, to fully understand the issues residents of Maryland are facing, and to make an informed decision on a plan that could help ensure all Maryland residents have access to health care services they deserve. So I strongly urge the Health and Government Operations Committee to give a favorable report on House Bill 329 and establish a Commission on Universal Health Care. This is a critical step towards achieving a healthcare system that is accessible, affordable, and equitable for all.
Thank you very much for being with us today. Will you please unmute yourself?
Hi, can you hear and see
Yes,
me?
yes.
Wonderful. My name is Jared Chabot, and I'm testifying on behalf of the Lower Shore Progressive Caucus in strong support of HB 0329 as an organization committed to advocating for policies that improve the lives of all people. The LSPC believes that healthcare is a fundamental right and a critical component of a just and equitable society. The COVID-19 pandemic has laid bare the stark disparities in our healthcare system, with rural areas, communities of color, and low-income households bearing the brunt of the pandemic's health and economic impacts. It is now more important than ever to ensure that every Maryland resident has comprehensive healthcare services regardless of their income, race, gender, or geographic location. The Commission on Universal Healthcare would be an important step towards achieving this goal. It would bring together stakeholders from across the healthcare industry, including providers, insurers, policymakers, and advocates, to develop a comprehensive plan for implementing universal healthcare in Maryland. Such a plan would help ensure that all Maryland residents have access to the healthcare services they need to stay healthy, prevent and manage chronic conditions, and address acute medical issues. It would also help reduce healthcare costs, improve healthcare outcomes, and promote health equity. We strongly urge the Health and Government Operations Committee to give a favorable report on House Bill 0329 so we can take a critical step towards achieving a healthcare system that is affordable, accessible, and leaves nobody behind in our great state. Thank you all so much.
Thank you for your testimony. We really appreciate it. Are there any questions for this sponsor and her panel? Seeing none, I know that I spoke with you, Delegate, and I actually asked you to meet with my vice chair, and that she's working with you on something.
Yes, ma'am.
I know that she's committed, even if we do not do anything this year, to be able to work with you in the interim on the language, for us to look into it further, okay?
Thank you,
And
Madam Chair.
my
Thank you,
pleasure.
Madam Vice Chair, also.
My pleasure. Thank you for being with us. We really appreciate it.
Thank you.
And this actually concludes the bill hearing on House Bill 329. And next, we have House Bill 958, Public Health Abortion. Delegate Metzgar. How are you?
Marvelous.
Do you miss us?
Question is, do you miss me?
Yes, we do. We do. We do. We do.
I tell people all the time, ladies and gentlemen, I live a dream and I'm enjoying my journey. And it is a delight. And again, let me just be formal here. Good afternoon, Madam Chair and Madam Vice Chair. Madam Vice Chair, we haven't had her selfie yet this year. And distinguished members of the Health and Government Operations Committee. It is my honor, again, to be here testifying before you all For the record, I am Delegate Rick Metzger, representing District 6 in Baltimore County. House Bill 958 is very, very special and very dear to me. It is a foundational bill prioritizing the basic ethical principles of all healthcare providers must adhere to while practicing patient care services. The central idea of this bill is to ensure that licensed physicians are the sole providers inducing abortions, as opposed to any other individual deemed as qualified healthcare provider. The language qualified healthcare provider is ambiguous, subject to women to be under medical care of anyone deemed qualified, but not licensed. Requiring licensed physician and only licensed physician to conduct such a procedure protects both the patient and the abortion provider. Additionally, this bill provides in the preservation of life upon the discovery of a fetal heartbeat. Just let me digress for just a second. Recently, I was visiting a church, and a lady came to me and she said, "Delegate, I know you're concerned about heartbeats." She said, "Let me just share a story with you for just a moment." She said that her son had a traumatic automobile accident, and she was able to find out that her son was a donor, and they donated the heart to another young man, and they were able to meet. And the woman said, "All I wanted to do was hear my baby's heartbeat." And when she heard the baby's heartbeat, she said it brought all of those thrills about when I was carrying that baby. So let me just encourage you to listen for the heartbeat, but life and the fetal visibility. Furthermore, this bill holds any person accountable who engages in conduct that aids or abets the performance of inducement of an abortion after determination of a fetal heartbeat shall subject to the law. Ultimately, the aim of this bill is to respect the honor and uphold the sanctity of life and individuals expecting women and the unborn, and I speak for them today. Respectfully, I ask for a favorable report on House Bill 958, and I also say that I know that there's many that are looking forward to enshrining the abortion into the Constitution of Maryland, but this bill will strengthen and encourage people to hear the heartbeat of their baby.
Thank you for your testimony, Delegate. Next, please.
Thank you. My name is Dr. Frank Arlinghouse, and I ask the members of the committee to return a favorable report on this bill. The state has a compelling interest to regulate legal medical procedures to establish reasonable regulations and restrictions, particularly for the well-being of the patients. If I were to ask this committee to consider one piece of this bill above all others, it would be that piece, that component, that requirement that abortions are performed by physicians. And I ask that not to restrict abortion, but to provide women the highest quality health care that they can get when they undergo that treatment. But beyond that, this bill does seek to set a new scientific standard as the basis for when an abortion should not be performed, recognizing that the beating of a human heart is detectable in utero, and when that heartbeat is detected, it means something. Penalties aren't provided for the woman, but for the physician who has a responsibility to follow the law. The bill goes further in providing other requirements involving informed consent, sonogram, and protection from coercion. Each of these is designed to provide women with protection, to provide them information, to give them the opportunity to, information on the life within her and the procedure she'll undergo, giving her that opportunity to choose life. I admit that provisions of the bill boldly look to support life, as well as informing and protecting women as they consider abortion. I stand with Delegate Metzger as on the side of protecting human life in the womb. But a beating heart means something, especially coupled with all the other different scientific markers of human life growing to maturity in the womb. I ask you to consider personally what that means to you and what other markers you consider significant in the development of that new life. If this bill isn't for you, where would you draw that line? But I ask that you return a favorable report on this bill for the reasons I've mentioned. Thank you.
Thank you, sir, for your testimony. Delegate, you have actually 3 more people on your panel. I'm going to call them, if that's okay with you, and then we'll open it up for questions. okay?
Sure.
And I think you have Danielle Pimentel, Shahona Faith, Laura Bogley. Will you be so kind and forgive me if I did not pronounce your name correctly? Last name Faith, Pimentel, and Bogley.
Good afternoon, Madam Chair and members of the committee. My name is Danielle Pimentel, and I serve as Policy Counsel at Americans United for Life. And I want to thank you for the opportunity to testify this evening in support of HB 958. I urge your support for the following reasons. First, the bill protects the health and safety of pregnant women and preborn children, which is a legitimate interest for the state of Maryland. In Dobbs, the Supreme Court stated that states have an interest in preserving prenatal life and protecting maternal health and safety and in mitigating fetal pain. However, as we know, Maryland allows abortions up to viability, which subjects women to life-threatening health risks. Additionally, scientists have found evidence of fetal pain as early as 12 weeks gestation. Maryland also does not have an informed consent process that would ensure that women understand these risks to them and the unborn baby. By enacting this bill and prohibiting abortions after detectable heartbeat, the bill will protect unborn children from fetal pain while also greatly reducing the risks that women face when they seek an abortion. Second, this bill also clarifies the pre-existing duty to obtain a woman's informed consent. Informed consent is a foundational principle of modern medicine. Healthcare professionals must receive a woman's informed consent before inducing an abortion. And this bill will ensure that women are given the medical risks of having an abortion, they're made aware of the risk of carrying her pregnancy to term, the alternatives to abortion, all material information to guide her in her abortion decision. This information is vital, as a woman may be seeking an abortion under coercion. Ensuring that these women understand the alternatives empowers them to make voluntary decisions and safeguards them from being coerced by an intimate partner, a sex trafficker, or a family member, which we know does happen. The women of Maryland deserve better than to be subjected to late-term abortion procedures that risk their life and their safety, and they deserve to know the risks and alternatives to abortion to empower them to make their own decisions and truly voluntarily choice. Thank you.
Thank you for your testimony. Next, please.
Good afternoon, Madam Chair and members of the committee. My name is Shohana Faith, and I'm the Capital Area Regional Coordinator for Students for Life Action. We support this bill because it upholds the humanity of the preborn child. Multiple other states have enacted laws that protect preborn children through gestation or once a heartbeat can be detected. Unborn child's heart begins to beat after 18 days. Numerous states have passed this legislation, and we think that it is a step that our state needs to take to continue to protect and cherish life. Additionally, this bill enshrines some safety standards for the health of women by restoring medical standards of care. In the last several years, the state of Maryland has done a lot to make abortions less safe for women. Many women can get abortion pills at pharmacies without additional tests or additional care. We know of many cases where women have died from malpractice relating to abortion. And so we want to see this pass because we think that even if you disagree on the morality of abortion, that you would at least uphold legislation that values their safety. Thank you so much.
Thank you for your testimony and your leadership. Next, please.
Thank you, Madam Chair, members of the committee. Again, Laura Bogley, Executive Director of Maryland Right to Life. I want to thank Delegate Metzger for introducing this legislation, and I strongly urge your favorable report. The bill asserts 3 legitimate state interests as recognized by the United States Supreme Court. The court, in its 2022 Dobbs decision, returned to the states the power to regulate abortion at any stage of pregnancy and reaffirmed the legitimate interest of the states. The court held, quote, "A law regulating abortion is entitled to a strong presumption of validity, and it must be sustained if there is a rational basis on which the legislature could have thought it would serve a legitimate state interest," end quote. These legitimate interests include respect for and preservation of prenatal life at all stages of development, the protection of maternal health and safety, and the preservation of the integrity of the medical profession, among others. Fetal human life is existing, not potential human life. By the time a woman learns she is pregnant, she has already reproduced human offspring. 95% of biologists agree that a new human life comes into existence at the moment of fertilization, not implantation, which is what we're incorrectly educating children in our schools. They're telling them that pregnancy begins at implantation rather than a new human life begins at fertilization. Detection of a fetal heartbeat after 18 days is sound medical measurement for verifying that a new and separate human life has in fact begun. This bill seeks to restore the medical standard of care to ensure women have access to safe medical procedures. The Abortion Care Access Act, enacted by this Assembly last year, removed abortion from the spectrum of health care by allowing practically anyone to perform surgical abortion and provide dangerous chemical abortion pills through birth. With the largely unregulated proliferation of dangerous chemical abortion pills, or do-it-yourself abortion, as the abortion industry itself has coined it, women have been returned to back alley-style abortions. A physician's examination is crucial to a woman's health, and we ask for your favorable report. Thank you.
Thank you for your testimony today. I will now open it up for questions. Are there any questions for the delegate and his panel regarding House Bill 958? So there are two questions. Delegate, will you be so kind and come up? Sure. I first have Delegate Johnson, followed by Taveras.
Thank you, Madam Chair. This question is for Danielle. You made a statement about late-term abortions. Can you tell us when late-term abortions are allowed in Maryland?
What I said was abortions are allowed up until viability, but there are broad exceptions to where abortions could occur even after that. So that would be late-term abortions is what I was referencing.
So can you tell us when those are allowed in Maryland?
Like I said, up until the point of viability, which could be anywhere between 24 weeks, if not a little bit later.
Under what circumstances?
I'm sorry, could you clarify your question?
Yeah, under what circumstances are late-term abortions allowed in Maryland?
Yes, there are exceptions for the health of the mother, broad exception for her health. So that would be later term abortions past viability.
Thank you, Madam Chair.
Delegate Taveras.
Hi, thank you. I just had also for Ms. Pimentel, I just had a question. You mentioned that there would be cases where individuals would be coerced to have abortions. Would you not consider a child that's been molested and not fully developed and doesn't have the hips in order to deliver, or the mother or individuals who are raped, or mothers who are, for some reason, like if their lives is on the line, that those are not indications where this may be necessary?
Well, this bill, I believe, allows for exceptions for those circumstances particularly, and the sponsor can correct me if I'm wrong, if that's inaccurate. So the bill would allow for that.
Delegate Kipke.
You're popular tonight. How is the health of the mother defined?
The health of the mother in Maryland's law? Unfortunately, I don't have that definition. I apologize. I can follow up with you, though, Delegate.
I'll take the question, Delegate Kipke. Thank you. And we appreciate AUL, who's a national organization representing in Maryland today. The statute has the broadly defined definition of health that we've heard throughout, federal law and case law as well. The definition of health is determined at the discretion of the abortionist. The abortionist can determine for any reason, including depression, anxiety, just concern about not wanting to be pregnant. All of those things the abortionist can take into consideration as a matter of mental health as well as physical health. Last year we paid for, in Maryland, I think about $7.5 million for about 11,000 abortions. Out of those 11,000 abortions, less than 10 were for rape, incest, or sexual assault. There was some number that was, I think, under 1,000 that was included for health of the mother. But again, this is a very broadly defined definition of health. And the reality is what we're hearing from not only women that experience abortion, but anecdotally through abortion clinic workers, is in reality, the women aren't getting any type of full, physician's exam or conversation about whether there's any type of medical need. And I think people think that there's a medical need when we talk about health of the mother. And again, most of the bills make exceptions for things like emergencies, medical emergencies, intervening medical emergencies. Many people misunderstand that things like ectopic pregnancy or miscarriage are not legally considered abortion, and women absolutely can get medical intervention for those pregnancy complications. But at the end of the day, this broad definition of health is really just a catch-all for essentially not wanting to continue the pregnancy. It's very broadly defined, no enforcement or oversight, no reporting.
Thank you very much for your testimony. Are there any other questions? Delegate Lopez.
Thank you. So if I'm reading this bill correctly, there's criminal penalties for a physician who administers an abortion. And so I'm wondering if you can tell the committee how a prosecutor could prove that there was criminal liability involved and someone unlawfully performed an abortion procedure.
Only one person can answer.
Thank you for your question. I truly believe that the criminal part would be if they found that they were unlicensed. If they were unlicensed, then it would be prosecution.
Well, it's not clear that's what the bill says. Perhaps there was an error in drafting.
Well, let me just clarify. If the physician is not licensed, or if the abortionist is not credentialed properly and licensed, then I feel that their prosecution, and I don't know, truthfully, I'm not a lawyer, but I don't know how that would take place, what would be the details of that, but if they're not licensed, that would be the start.
Thank you. Any other questions? Seeing none, thank you so much for being with us today. We really appreciate it.
Thank you, Madam Chair, Vice Chair.
Great to see you.
I love everybody in this room.
Thank you.
Some more than others.
Yeah, you're loved as well. This actually concludes the bill hearing on House Bill 958. Next, we have House Bill 973, Health, Abortion, Ultrasound, and Waiting Period. Is a delegate here? What is Delegate Siliberti? He wasn't here today. Is there anyone here for that bill? But you know what? We'll make a call. Let's wait because it's his bill. We'll make a call and see if he comes, and if he doesn't, then we'll take the witnesses. Let's go on to House Bill 1043. Delegate McComas, Public Health, Pregnancy, Coercion, Coercive Abuse Against Mothers Prevention Act, House Bill 1043. Will you be so kind and come up with your panel? Yes, please. Thank you.
Thank you, Madam Chair. I appreciate you taking the time out to hear this bill. My name is, for the record, Susan McComas. I represent Legislative District 34B in Harford County. This is testimony in support of HB 1043, Public Health, Pregnancy, Abortion, Coercive Abuse Against Mothers Prevention Act. HB 1043 prohibits a person from committing or threatening to commit coercive acts with the intent of leveraging a pregnant woman to have an abortion. It also provides that a pregnant minor is to be considered emancipated for purposes of being eligible for public assistance in situations where they are without support from a parent and/or legal guardian due to their refusal to voluntarily seek an abortion. This bill further provides that facilities that perform abortions must post certain signage in certain rooms of the facilities that are meant to reinform that the pregnant woman that they have choices and that outreach programs are available for them if they choose not to have the abortion and they can have support. Abortion is often anything but a choice. Using coercive control, women are often subjugated to the desires of others, including partners, parents, friends, or employers. The Daily Beast has acknowledged that coercive abortions are a twisted form of domestic abuse occurring more often than previously thought. Coercive abuse can take many forms and is intended to force a woman into choosing an abortion. Untold numbers of women have suffered, including, by example, Caitlin Camp, a 19-year-old college student and former high school honor student, was bound and gagged by her parents who disapproved of the child's father and forced into a car to make a trip from Maine to New York, where they knew someone who would perform an abortion. Unfortunately, Caitlin managed to escape when she convinced her parents to let her use the restroom in a store. Police later found a .22 caliber rifle, rope, and duct tape in the car. My testimony is annotated, so if you wish to check the actual sources. Shalana Alexander, an assistant women's basketball coach at University of California at Berkeley, was told by her boss, Mariana Stanley, that she needed to have an abortion to keep her job. When Alexander refused, Stanley demanded her resignation. A 16-year-old Cleveland girl was beaten with a metal broomstick by her father, who wanted her to get an abortion. A 16-year-old Georgia girl was forced by her mother and two cousins to drink turpentine in order to induce an abortion. And Shantarisa Ote was told by Emergency Shelters, Inc. of Richmond, Virginia, that she would not be eligible for a room because she was pregnant. A staff member then drove her to the bank to withdraw money for an abortion and took her to the abortion clinic. Clearly, many women who arrive on the doorstep of an abortion clinic are not there of their own free choice. Instead, they are there because others are pressuring or forcing them to undergo the procedure. Hundreds of women have testified to the devastating effects of their coerced abortions. At least 18 states currently have some form of coercive abuse prevention law. Arizona, Delaware, Idaho, Kansas, Louisiana, Michigan, Minnesota, Missouri, Montana, Nebraska, North Dakota, Ohio, Oklahoma, South Dakota, Tennessee, Texas, Utah, and Wisconsin. Many of those states are not what I would call red country, MAGA country, or conservative. Research indicates that violence against pregnant women is a serious problem. Many women report that they were coerced into abortions and have suffered grievous physical, emotional, psychological, and spiritual harm as a result. Reproductive health care facilities are often the only and last opportunities of hope for victims of coercive abuse, and as such are in unique position to help these women. More cases of coerced attempted and coerced abortions are reported if women were informed of their rights and given information concerning treatment and abortion options. Some women coerced into having abortions are in fact also victims of human trafficking. Coercive abuse is a serious woman's health issue because it violates a woman's right to physical and emotional health, freedom of conscience, and to freely choose either to continue her pregnancy or to have an abortion. Unfortunately, one of my witnesses didn't sign up within the 48-hour period, but the good thing is he signed up for the 48-hour period to be able to speak on the Senate bill, which was heard yesterday, and I got a copy of some of his written testimony. I am Mr. James Kelly, a physician and a psychiatrist with 35 years' experience treating women who have had abortions. The majority of post-abortive women that I have treated have told me that they felt coerced into their abortions. Coercion comes in many forms. Common forms of coercion include various types of threats, including loss of relationships, abandonment, being taken out of school or kicked out of their homes, and overt physical threats and violent physical assaults. Coercion often comes from the baby's father or her own family. Some of the women were teenagers, some were adults, and some were enslaved in sex trafficking and coerced prostitution. Part of a proper psychiatric or medical evaluation is to ask the women about the past history, including relationships and pregnancies. Typically, the women will tell me that I am the only healthcare provider who has given them the time to discuss their abortions. Usually, they say other physicians limit the discussion to listing the number of abortions and births and the end of the discussion. Often when asked about pregnancies and abortions, the women will spontaneously cry and describe their pain and remorse. They often say they have been told that they should not have the true feelings and symptoms that they have. Usually they are very pleased to have someone to confide their abortion story to. They often describe symptoms of post-traumatic stress disorder, depression, anxiety, suicidal attempts, crimes, self-injurious behaviors such as cutting, burning, banging, and abusing themselves, and other mental illnesses that all started with their coerced abortion. I would just say that these women need to be given a real choice, because once they get the abortion and they weren't really, let's say, old enough to decide independently what was the best thing, and then later they suffer these adverse physical and mental experiences, their life is pretty much set on a downward trajectory of either drugs, abortion, failed relationships, or drugs, alcoholism, failed relationships. So HB 1043 provides for the prohibition of actions intended to coerce or otherwise force a woman to abort her unborn child.
Delegate McComas, will you
I'm
please wrap
just
it up?
wrapping up.
Please,
Just
thank you.
one more sentence. More importantly, empowers all mothers of the state of Maryland to exercise their freedom of choice in choosing a life for their unborn child free from violent and abusive coercion. Please support a favorable report of HB 1043. And with that, I move on to have my panel introduce themselves.
Yes.
I'm Deborah Braccato with Campaign to Protect Women, and we are strongly in favor of House Bill 1043. The Assembly has made dramatic changes to health care delivery, especially where abortion is concerned. These changes have made it easier for the abortion industry to prey on women and girls, and easier for sex traffickers and other abusers to continue their coercive and criminal behavior. I think about my daughters and many other young girls, high school and college girls, who do not need parental consent or notification. The abortion industry has turned motherhood into something to be dreaded instead of the cherished gift that it is. How many girls will feel pressured by boyfriends, teachers, college professors to make their pregnancy go away? How many will suffer injury or death because their parents are unaware their daughter is post-abortive with infection or hemorrhage, but think it's the flu or she is run down? There are 2 all-trimester abortion centers in Maryland, and one of those is in College Park, home of our state's flagship university. Young women from the pregnancy center where I volunteered who had experienced abortion would say, "I can't kill another baby," and tell how it was their boyfriend or family members that forced them to get their abortion. They felt backed into a corner. Believe the women, they were coerced. The 15-year-old who came to Planned Parenthood on Howard Street in Baltimore City, flanked by her aunt, her grandmother, and her uncle, tears streaming down her face. I provided information about crisis pregnancy centers. The women stood in front of this girl and said, "The boyfriend won't help. She's too young. She must get the abortion." They made the decision, not the girl. The girl continued to cry. That's coercion. It is clear these young girls are pointed in only one direction. They are coerced into taking a permanent action for a temporary condition, which can cause physical, emotional, and psychological injury. The young girls go into the abortion center and receive the abortion during that visit. If there is a consultation, it is with a virtual stranger, and there is not adequate time to think about a decision that cannot be reversed. When making material purchases, returns are possible with a certain time frame. This is a purchase that cannot be returned. Campaign to Protect Women knows there is opposition to this bill, which is hard to understand. We urge both sides to work together to believe the women and to respect and protect a woman's right to motherhood. We strongly recommend this committee give a favorable report to House Bill 1043. Thank you.
Thank you. Next, please.
Good afternoon. My name is Shohana Faith with Students for Life Action. We support this bill and the efforts to protect Maryland women from being pressured into unwanted abortions. In my personal experience as a sexual assault survivor, I have noticed one thing, and that is that the men who will force themselves on women will also stoop to coercion and violence to force a woman to abortion when their actions result in pregnancy. I'll repeat that again. Men who will force themselves on women are not necessarily upstanding citizens that will not stoop to coercion and violence. While my traumatic experience did not result in pregnancy, I know that if it did, my high school boyfriend, who was a few years older than me, who assaulted me, would have likely coerced me to cooperate with his wishes to cover his actions up. We have a responsibility to protect women in Maryland from such coercion. According to a Charlotte Lozier Institute study released in January of this year, 61% of women who obtained abortions reported pressure from male partners, family members, other persons, or financial concerns. The study also found that perceived pressure was significantly associated with more negative emotions, dreams or flashbacks to the abortion, feelings of loss, grief, and sadness, and a decline in overall mental health. According to another study by the Beasley Institute, 66 human trafficking survivors were interviewed, and it was discovered that they had a total of 114 abortions among the 66 of them. A majority of these women said that coercion played a major role in at least one of their abortions. Research such as this is why multiple states have already passed or are considering anti-coercion abortion laws. It's a necessary step to ensure women's safety from coercion from their partners, family members, or other abusers. It is long past time that this is implemented in Maryland because Maryland women deserve better than being pressured into unwanted abortions. It is for all these reasons that we strongly urge a favorable report on House Bill 1043. Thank you so much.
Thank you, and thank you for sharing your story
Thank you, Madam
with
Chair.
us. You know, I'm sorry you had to experience that, okay?
Thank you very much, Madam.
Welcome.
Madam Chair, we have more witnesses here too.
You have more witnesses, but which one is your panel? Is this your panel?
Well, this is my first panel. This is my second panel. in
Right,
that.
but you want me to call them all before I open it up for questions?
Uh,
Do you like me to
yeah,
call
if you
them all?
want, but I want the other folks to be
Oh,
able to
they
testify.
will, absolutely.
Oh,
But do
okay,
you
all
want
right.
me to, I'll
Fine.
just call them and then I'll ask for a question, okay?
Okay.
Francis, Arlenhorst, Paige Burns, will you be so kind and come up? Noah Slater and Laura Borgley. Danielle Pimentel, if you can all come up, pull a chair, please. That would be great. And will you please start the timer? Thank you.
Thank you, Madam Chair. My name is Dr. Frank Arlinghouse. I'm the father of 3 daughters, and I ask the members of the committee to return a favorable report on House Bill 1043. Abortion is legal in Maryland, and this bill does not try to change that. What it does do is provide women, especially minors, protection from being coerced into abortion by boyfriends or parents or abusers. The state has a compelling interest to do this, consistent with the limitations and restrictions of the abortion amendment potentially coming to referendum. The bill provides solid protections from coercion, gives the victim explicit rights, and provides additional protection to minors. By having information in abortion facilities, it allows victims of coercion to get information on the help they need when they need it, by placing some responsibility from coercion. Too often we hear stories from women who've had abortion about that coercion, often by spouses or boyfriends or parents. I'm also here on behalf of my daughter Teresa to share the story of her friend Kaylee, who along with her child were the victims of violence perpetrated by the father of her child. This is an example of coercion gone a step further. Kaylee was a happy, vibrant teenager who wanted to reconcile with the father of her unborn baby, despite his opposition to her continuing her pregnancy. Like many of the women who were victimized by the gap in our fetal homicide law, which uses viability as a marker, Kaylee was beaten by the father. He first assaulted her by kicking her in the stomach while discussing the pregnancy. Even worse, as the incident ultimately ended in her death by strangulation after the assault, and in the death of the child she was carrying in her second trimester of pregnancy. I'll note that the father and murderer will spend at least 14 years in jail, but he could not be charged in the death of his child. In fact, had he not completed the killing of Kaylee, the penalties for causing the fetal death of his child would have been limited to assault. We're also aware of a case locally when we were considering Laura and Reed's law, the case of Laura Wallen. I know you're all familiar with that, so I'll just leave it there and ask that you return a favorable report on House Bill 1043 for the reasons outlined above.
Good afternoon, Madam Chair again, and members of the committee. My name is Danielle Pimentel with Americans United for Life. I want to thank you again for the opportunity to provide testimony in support of this bill, which is based in part on one of our model bills. The bill specifically prohibits an individual from engaging in coercive acts against a pregnant woman who refuses that individual's demand that she seeks an abortion. These safeguards are needed in Maryland because many women seek an abortion due to intimate partner violence or reproductive control from either an intimate partner, a family member, or a sex trafficker. Studies across the board show that a large percentage of women, have been coerced into having an abortion. For example, one study that I cite in my written testimony found that 73.8% of women said that they disagreed that their decision to have an abortion was entirely free from even subtle pressures from others to abort. Victims of sex trafficking are among the number of women who experience reproductive control. And the bill therefore responds to the rising need for legal protections for such women by requiring that abortion providers ask direct questions that can help them identify victims of sex trafficking, as well as requiring signs to be posted in abortion clinics so that women know, and whoever accompanies them, which may be a sex trafficker, that they know and understand that that coercion is wrong and also sex trafficking is illegal. Both are illegal. These signs would also provide women with the information on how to discreetly tell the provider that they are a victim of sex trafficking. And these are necessary safeguards given the prevalence of sex trafficking, unfortunately, in Maryland. Between June 2013 and April 2020, there have been 671 reports of suspected sex trafficking reported in the state, with most of the victims being between the ages of 14 and 17. Even Maryland's Governor's Office of Crime Prevention, Youth, and Victim Services states on its website that Maryland is an attractive destination for traffickers. And I'll end with this. Many women come to an abortion clinic not of their own free choice, but because they're being pressured to do so by others. And for these reasons, I urge the support of this bill, which would not only prevent coerced abortions, but would also possibly increase the number of women and young girls rescued from sex trafficking. Thank you.
My name is Paige Burns. I have been personally devastated by abortion. At the age of 15, I became pregnant and was coerced by family members to get an abortion. Pregnant again at the age of 19, the same people explained to me that abortion was my only practical option. No alternatives were explored, no hope given for the future, no discussion of ramifications, which are, by the way, extreme and horrible. The decisions made are forever etched into my mind and heart, occurring because of selfishness and bad counsel. The children I would never know, the lasting effects on my living children, the physical health concerns, the never-ending pain and suffering that resides in me as a result, knowing that my children, my own flesh and blood, were callously destroyed. The realization that the removal of children from my womb did not make me unpregnant, but instead made me the parent of deceased children. Pregnancy centers, which I knew nothing of at the time, provide free and confidential resources and supplies. They provide counseling and complete information to anyone who is pregnant regarding the choices available to them and the repercussions of each of those choices. Abortion providers do charge for their services. I don't understand why the state government is so reluctant to provide even the smallest protections for women and children, instead focusing on funding abortion providers who push one option only and who were complicit in leaving me in the dark and perpetrating irreversible harm on me and my family. Women need real choices, not to be pressured into what they believe will be an easy way out, only to find that their decision will lead to devastation and pain beyond their imagination. Abortion kills children and hurts women. When all the facts are presented to someone, this empowers them to make an informed, healthy decision for themselves and their families. There is no easy answer for women who find themselves in difficult situations like these, but understanding available solutions is the key. If your desire is to protect women and children, I implore you to pass this bill. It is a start and the very least that you can do. Thank you.
Thank you, and thank you for sharing your story. The committee appreciates it. Is there a Annalise Backman? Yes. Noah Slater and Laura Blogley. Can you get started, please?
Hello, my name is Noah Slater. I am a student spokesperson for Students for Life Action and a current college student. I am testifying today in support of House Bill 1043, the Coercive Abortion Against Mothers Prevention Act. While I am strongly pro-life, this is a bill that we all should be able to agree on, regardless of personal views on abortion, as everyone should want to protect women from coercion. For those who oppose this bill and call themselves pro-choice, I ask you to remember that this is the point of the bill, as statistics from post-abortive women show us that many were pressured into their decision to abort by others, not by their own choice. These women reported that they felt pushed to have an abortion by their partners, parents, or other family members, and even human traffickers. They felt unsupported in their desire to keep their children and forced to end their lives. If we truly want Maryland to be pro-woman and pro-autonomy, we need to take a stand against those that bully pregnant mothers. Maryland needs to be a state that affirms mothers, showing that women can raise a child, finish school, and have a career. I ask that you empower and defend Maryland women against coercion, allowing them to see that abortion isn't their only option by supporting HB 1043. Thank you.
Thank you for your testimony today. We appreciate it. Next, please.
Good evening, members of the committee, Madam Chair and Madam Vice Chair. My name is Annalise Bachman, and I serve as Vice President of Rockbridge Academy Students for Life. I am here in support of HB 1043 today because everyone here should agree that no woman should be forced into an abortion. Whether it is parents, friends, employers, or human traffickers, a pregnant woman can be surrounded by any number of people who want to make decisions for her and will use force if necessary. The most coercive of these relationships is one between a trafficker and their victim. According to former senior advisor on trafficked persons at the State Department, Laura Lederer, 55% of trafficked women had abortions, and 30% were forced into multiple abortions during the time they were trafficked. This faces us with the reality that a woman walking into an abortion clinic may be there under threat from a trafficker. What HB 1043 would put into law are easy to safeguards to make sure that women do not walk out of clinics and back into the hands of their abusers. It would require abortion facilities to ask a woman if she is being coerced or trafficked, post signage informing her of her rights and where to get help, offer her private phone calls, and get her out by a safe and separate exit. These clinics are being asked to go the extra mile because the data proves that the victims are coming to them, and they should be met with help and empowered to make their own choices. We cannot pass on the vital opportunity to intercept a woman or girl out of a cycle that is profiting on her pain. If just one woman or girl is able to escape a cycle of exploitation because you supported HB 1043, I think all of us would agree that your support was well worth it. And with that, I ask you, members of the committee, to please support HB 1043. Thank you.
Thank you. I'd like you to follow that testimony. I don't think you can.
You stole my line, Chairwoman.
I don't think you can.
Yeah, very promising young students. Thank you. So again, my name is Laura Bogley, Executive Director of Maryland Right to Life, and on behalf of the Board of Directors, I strongly support this bill and urge your favorable report. We sincerely thank Delegate McComas for introducing the bill, which is a reasoned and compassionate response to the needs of concerned pregnant women. This bill will ensure the best possible outcome for a woman's physical and emotional well-being. The decision to abort one's child is a difficult, life-altering decision, and informed consent is critical to this decision. Informed consent laws, including waiting periods, are essential tools in protecting women from intimate partner violence and coerced abortions. Another study reported that as much as 73%, or even 3 in 4 women, said they did not choose but felt pressured into their abortions. Sound abortion regulatory policies serve women by promoting a high standard of medical care, protecting women's right to give voluntary informed consent to procedures, and protecting women from abortion coercion at the hands of abortionists, abusive partners, and yes, sex traffickers. The connection between abortion and sex trafficking cannot be denied. Abortion centers that turn a blind eye for profit enable the sex trafficking industry. You heard earlier about the groundbreaking Beasley Institute study, and that 66 human trafficking survivors had a total of 114 abortions. A majority indicated that coercion played a role in at least one of their abortions. Nearly 30% said they went to Planned Parenthood. One survivor who endured 6 abortions recounted, quote, I was under serious pressure from my pimps to abort the babies. I got pregnant 6 times and had 6 abortions during this time. Several of them were from a doctor who was a client. He did them backdoor. At least one of my abortions was from Planned Parenthood because they didn't ask any questions. You went backdoor where the charge was more like $150, end quote. Currently, federal regulations and all 50 states have laws requiring healthcare professionals to report the suspected sexual abuse of minors, including statutory rape. But the Guttmacher Institution says that abortion providers in Maryland are excluded from this requirement. As a result, Maryland is known as a hotspot for sexual predators and sex trafficking. So again, we ask you to put women before politics and issue a favorable report on this bill. Thank you.
Thank you. I'm going to open it up for questions now. We're going to go to the virtual witnesses afterwards, okay? Delegate, would you like to come back? I'm going to ask questions now. Open it up for questions. Are there any questions for the delegate and her 2 panels? Okay. Seeing none, thank you very much. Appreciate it.
Madam.
You're welcome. Will you please allow the virtual witnesses to come in? Good evening, and thank you for your patience. Will you please, let's start with Ms. Eileen Roberts, because you're the one that is not muted.
Yes, hi, my name is Eileen Roberts. I'm not sure the video is working well.
You know, may I ask you, could you turn the video off and just give us your testimony? Because the video is not working, and then we'll be able to hear you better.
Sure, is that good?
Absolutely, and thank you for
Okay.
being flexible.
Yes, good evening. My name is Eileen Roberts. I'm the founder and president for Parents for Life. Since 1987, Parents for Life has served as a collective voice for parents, educating the public and state legislators of the need for public policy which protects our children. More importantly, however, I am the mother of a daughter who became severely depressed. Believing her boyfriend had introduced her to drugs, we searched for answers, but instead of finding drugs, we found a questionnaire from an abortion clinic that we found under her pillow. Her boyfriend and an adult friend intruded our parental rights and drove my daughter to the abortion clinic. While in the hospital for follow-up care for depression, it was discovered that her legal abortion was done incomplete and she needed surgery to repair the damage done by the abortionist. But she could not have that surgery unless I signed a consent form for the reparative surgery. But yet I didn't even have to know about the abortion. To add insult to injury, my husband and I were responsible for the costs that amounted to over $27,000. No one knows our children better than we do. My daughter had been told, wait a minute, go home to your parents and let your mom put her arms around you and say, I love you, we can work this through together. If my daughter was sent home to me, I know without a doubt my daughter's complications would have never happened. I am not naive to know that some children are from abusive homes, but what we're doing in this country is giving our daughters secret abortions and sending them home to the abuser and also sex traffickers. Please allow parents to put their arms around their daughters and say, I love you, we can work this through together. This bill would also restore family dignity. I am here this evening to ask this committee to favorably pass HB 1043 because Maryland parents deserve better. Thank you.
Thank you, and thank you for sharing your story. We appreciate it. Let's go to Ms. Palumbo, because you are unmuted.
Thank you very much. My name is Pamela Palumbo, and I serve as president of the Maryland Coalition of Medical Pregnancy Clinics, which represent 30 medical clinics across our state, caring for more than 20,000 women a year. I urge you to vote in favor of HB 1043, which seeks to stop the violation of a woman's right to not be forced or coerced into an abortion. Well, we would all like to think that this isn't happening. That is absolutely not the case. I speak from direct daily experience of caring for women for the past 40 years in my 3 local women's clinics in Annapolis, Bowie, and Severna Park, as well as 27 others across our state. Adult women and some as young as 13 who are pregnant, who we see often have others pressuring and coercing them into abortion. This also occurs from parents, pimps forcing trafficked women, boyfriends and husbands emotionally or physically pressuring a woman to have an abortion. What has often been ignored is this link between forced abortion and forced prostitution. Gravely, there is a full trafficking women visiting Planned Parenthood and others. Never ask if they were being forced to engage in the prostitution or have the abortion. By the University of Florida Journal of Law and Public Policy state that, quote, Planned Parenthood is in an advantageous position to detect sex trafficking and to provide life-saving health services to these victims. Although traffickers often do not allow their captors to seek medical care, abortion can be the exception to the general rule, end quote. Studies have identified healthcare providers as critical potential identifiers of trafficked victims, and Planned Parenthood is the largest provider of abortion in Maryland. They are in a unique position to prevent women from being forced into abortion by supporting this legislation. This will in no way impede women's right to choose abortion for themselves, rather allow you as legislators to save women from the emotional, physical trauma of forced abortion and simply allowing them to receive the information they cannot be forced into this. I thank you and urge your support for Bill 1043. Thank you.
Next, please. Ms. Lester? You have to unmute yourself.
There we go. Sorry, I couldn't figure out how to do it. My name is Kelly Lester. I am with And Then There Were None. We are an organization that helps former abortion workers. We have over 650 workers who can testify that over 30% of us, when we were working in the industry, knew that our clients were being trafficked and we did not report it. Also, we knew that over 60% of the women that came to us were being coerced. So this is not some hypothetical thing that we think, that people say. I can tell you as a former worker that this was something that we were trained to do. We were trained to not ask questions, to not ask things that might cue us that a woman was being trafficked or that a woman was being coerced. Because if we did, first off, we would have to make a report on it, which looked negatively on us. And secondly, it would take money away from us. And so we were told not to ask those questions. I can also speak as a woman who at 15 had my first abortion. And at 15, I was on track to go to college with a college scholarship for tennis. And if I had continued that pregnancy, I would have lost that scholarship and I would not have been able to continue playing tennis. And so I was coerced into having an abortion. This law does not stop women from having an abortion. This law does not prevent that. What it does is it prevents women from being forced into having an abortion. It prevents workers from making decisions that would help facilitate traffickers, that would help facilitate abusers. Many of us workers, had there been a law like this in place, we may have said something because we didn't want to be criminally charged, or because we didn't want to pay fines, or because there was laws out there saying that you cannot do this. And so I urge you to vote positively for this. Do it for the safety of the women of Maryland, and honestly, for the safety of the women around the country that are traveling to your state. Thank you.
Thank you, and thank you for your testimony. We appreciate it. Next, please.
My name is Martha Shupin. I'm a medical doctor specializing in psychiatry, and I am urging you to support House Bill 1043 favorably. Besides being a medical doctor, I completed a year of research training at Harvard Medical School, and I teach continuing education workshops to professionals on the very concerns that HB 1043 addresses. Research shows that the majority of women who have been trafficked have had multiple forced abortions. One woman reported having had 17 abortions while she was trafficked. The American Psychology Association had a task force on human trafficking. They expressed concern regarding the psychological risks of forced abortion of trafficked girls and women. A textbook of the National Abortion Federation says that when women are coerced to have an abortion, they are at increased risk for adverse psychological reactions after the abortion. And some of these reactions can last for decades, in my experience. The American College of OBGYN has written statements about intimate partner violence and reproductive coercion. They say 324,000 pregnant women experience partner violence every year in the United States. The risk of partner violence is 3 times as high among women seeking abortion, and violence is often used by some people to coerce a woman into an abortion that she does not want. The American College of Obstetrics and Gynecology recommends that steps be taken to prevent reproductive coercion. And what is proposed here is a step that would help prevent that, prevent reproduction coercion. In my 35 years of psychiatric practice, I have treated many women for psychological distress associated with coerced abortions, including Maryland women. I urge you to support HB 1043 because it will help to prevent the distress of an unwanted abortion. Thank you.
Thank you, doctor, for your testimony today. We really appreciate it and for your patience while you waited. Are there any questions for these witnesses? Seeing none, thank you so much for being with us tonight. This actually concludes the bill hearing on House Bill 1043. Next, we have House Bill 973. The delegate, we reached out to him and we could not find him. Is Delegate McComas here? Will you be so kind? Do you want to present his bill? You are actually, I think you're on the bill. Yes, you are. You're no. Do you feel comfortable or no? I'm going to call the witnesses. Do I have Annalise Backman, Francis Arlenhorst, Hannah Bates, Laura Bugley, Shahana Faith, and Danielle Pimentel? Will you be so kind and come up? If you could explain the bill, who can explain the bill?
Delegate McComas.
Okay.
I didn't realize I was going to have to present it, but I'll.
All right. You want to go ahead and start with the, let's, yeah, sure. You can come up, pull up a chair.
I'm a little hard of hearing, so I apologize.
Yes, come forward, have a seat, please. Thank you very much.
All right.
And thank you for doing this, because I know you were not ready. That's very kind of you to do that to him, for him.
Well, he may be stuck in environment transportation. I
Yeah,
mean, it's been
that's
kind of
okay.
crazy day.
Yeah, we're flexible. You're number 2 on the bill, and if you feel comfortable and want to just tell us a little bit, maybe just read the fiscal note, the paragraph on the fiscal note that explains the bill, and then we'll let the witnesses give their testimony if you like.
All right. Informed consent policies are not an attack on reproductive freedom, but a guarantee of it. The decision to abort one's unborn child is a life-altering decision, and informed consent is critical to a woman's physical and mental health. Generations of women have been lied to and told that their living preborn child is just a blob of tissue. This bill gives a woman considering abortion non-judgmental, scientifically accurate medical facts about the development of her unborn child, including the right to view an ultrasound of her growing child. 81% of women who have the opportunity to view their growing baby by ultrasound choose life for their child. But profit-minded abortion providers have been allowed to deny women the right to view the ultrasound of their baby before inducing abortion. Instead, abortionists use ultrasound only to determine the gestational age of a baby or to direct their brutal dissection and evacuation of fetal bodily parts. In a national Gallup poll, 88% of Americans favored informed consent laws. 78% favor waiting periods. Even before the Supreme Court, in its Dobbs decision, returned to the states their power to restrict abortion practices at any stage, state-informed consent legislation, including ultrasound laws and waiting periods, have consistently been upheld as constitutional. Dr. Bernard Nathanson, co-founder of the National Association for the Repeal of Abortion Laws, is known as America's abortion king. After killing over 75,000 preborn babies, Dr. Nathan was able to view real-time ultrasounds and stated, in quotes, "As a result of all this technology, I finally came to the conviction that this was my patient. This was a person. I was a physician pledged to save my patients' lives, not destroy them. So I changed my mind on the subject of abortion," unquote. If the state considers abortion health care, then you must hold abortion providers to the same standard of medical care as all other health care providers and require them to obtain a woman's voluntary informed consent before inducing abortion. Please pass this bill, which is absolutely the minimum that the state of Maryland can do to protect women's health and reproductive freedom, and I urge a favorable report. Thank you, Madam Chair.
You gave it very, like you were ready for it. All right, very good. Next,
Well,
please.
I try to please.
You did
Don't
well.
always get there.
You did well, Delegate. Who's next?
Hi, my name is Hannah Bates,
Good evening, Madam Chair and members of the committee. I'm a member on the leadership board of Rockbridge Academy Students for Life, and I want to support HB 973. Multiple studies show that around 70% of women who see their ultrasounds forgo an abortion. This shows that ultrasounds are necessary information for pregnant women to have. If it changes so many minds, then the pictures must contain pertinent material women want to have before making a final choice on whether to have an abortion. A real healthcare system would care about the women who want to have abortions and provide them with any and every resource available. And this especially means ultrasound pictures. Choosing whether or not to have an abortion is a hard decision. No one disputes that. There is often pain and pressure on women who get abortion procedures. Again, the least a clinic can do for a woman is to give her pictures of the baby growing inside of her. One last thought. Many of the most important decisions of life come with second chances, but abortion does not. If one goes bankrupt, one can always make more money. If one loses their house, they can always buy another one. There are always new friends to be made, new experiences to be had, and even the ability to get married, divorced, and remarried. But once a woman has an abortion, she can never get that child back. Furthermore, abortions come with the risk of permanent sterilization if the uterus tears. Besides never getting that aborted child back, they may also not be able to have any other children. There really is no mercy in abortion. It is a hard choice that one will have to live with forever. This is why it is so important to give women the resources and time to think through this heavy, long-lasting choice. So I urge you to pass HB 973, which will give women the ability to choose with an informed, reasonable mind what is best. Thank you for your time.
Thank you for your testimony. Well done. Next, please.
Good evening again, members of the committee, Madam Chair and Madam Vice Chair. My name is Annalise Bachman, and as I said earlier, I am Vice President of Rockbridge Academy Students for Life Group. I am here today representing high school students who share my hope that our state values the consent and safety of Maryland women. While claiming to give women a choice, the abortion procedure, which has lifelong significance for a woman, is rushed to a point where she can secure the procedure without any waiting period and without any screening for complications. Today's question is not about pro-choice or pro-life. It is simply asking whether or not Maryland women have the right to know what abortion does to their bodies. With the rise of chemical abortions in our state, where procedures are replaced with pills, lack of an ultrasound can mean infertility, sterility, and even fatality if the child's gestational age is past the 10-week mark or if the mother is experiencing an ectopic pregnancy. Women need ultrasounds and waiting periods to fully consent to an abortion. Maryland has a proud history of upholding consent as the host state of the Belmont Convention, resulting in the 1979 Belmont Report, which serves as the basis for all major international bioethics codes, like the Declaration of Helsinki and the World Health Organization's Declaration of Human Rights. Its first tenet is respect for persons or consent, which says that full consent is informed consent, and in this case, which would give a woman time and knowledge to consider if an abortion is her best choice. Decisions of this weight demand consideration, and 24 hours is a perfectly reasonable time to consider the gravity of having an abortion. Time and ultrasounds are not threats to either side of this issue, and if a woman changes her mind because of these things, this is not an encroachment on her freedom. Rather, she is being empowered by these tools to make an informed decision. The safety of women must be a bipartisan issue, and I ask you to protect women's consent in law by supporting HB 0793. Thank you for your time this evening.
Thank you. Are there any questions for this panel? Seeing none, thank you so much for being with us today. Next, we have Mr. Francis Arlenhorst. Laura Boagley. You can start, sir.
Okay. Once again, my name is Dr. Frank Arlinghouse. You have a copy of my testimony that was submitted previously, but I want to just mention a couple things. This isn't an attempt to restrict abortion. This is an attempt to provide women with better medical information based on science. Patients need to be fully informed of their options, and one of the ways of doing this is providing them with an ultrasound. These serve an essential medical purpose in confirming the presence, location, and gestational age of a pregnancy, as well as helping detect potential medical problems. Those of us who've experienced a pregnancy, the birth of a child, going through a pregnancy with a spouse or with a girlfriend, we understand what that ultrasound shows. It's about providing women more information. If abortion is health care, let's arm the patients with better information. I often speak to the point that I have 3 daughters. Well, I actually have 5 children. And in some of those pregnancies, the number of ultrasounds done was more frequent. And that's because it was an important diagnostic tool for monitoring what was going on. I'll also note that my parents had to wait until I was born to have pictures of me. But each one of my children, I have a picture of in utero. I have multiple pictures in utero of some of them. And that's so true more and more now. My oldest is 28. I have a grainy picture for him. But the ultrasounds today show so much more. And it's important to give women this information. It's important to treat this as healthcare and arm them with all the information that we would arm them with in other procedures. So because I want women to have that information, then I ask that you return a favorable report on this bill. Thank you.
Thank you for sharing your stories. Next, please.
Thank you again, Madam Chair. Laura Bogley, Maryland Right to Life. I've donated my testimony, so I'm just going to speak from the heart with you for the
that was very
few
generous.
minutes. Yeah. I hope Delegate Celebrity appreciates the effort. But I just wanted to share with you a little bit about ultrasound in the context of chemical abortion pills. You all have heard testimony throughout session that chemical abortion pills now make up the majority, 54% of abortions in the United States. We've told you about the risk of chemical abortion pills, that they're 4 times more dangerous than surgical abortion, that in the first 10 years that they were approved by the FDA, emergency room visits related to the use of chemical abortion pills increased by 500%. But the correlation with ultrasound is that the FDA has reluctantly approved this and recently reluctantly removed safeguards for the use of chemical abortion pills. But they're only indicated for the first 10 weeks of pregnancy. So many women don't even know they're pregnant until 8 weeks. So really, it's a very limited use for these pills. But these women are not given the benefit of a physician's exam, as the FDA originally required or recommended, but they are trusting the women to determine their own gestational development, to determine whether or not they qualify for the chemical abortion pills. Many women have no idea when their last period was. They have no idea how far along they are. But profit-minded abortionists, and now anyone that's a certified prescriber or distributor, just wants to get that form filled out so they can prescribe the chemical abortion pills. So what they're doing is sometimes they're telling women to go get their own ultrasound. And some of these women are going to these kind of commercial ultrasound places where they take pictures, the ultrasound, and make cute little cards or cute t-shirts or cute little mementos about your baby. And that is what they're using to determine whether or not these women are eligible to use these dangerous chemical abortion pills. So we urge your favorable report on this bill.
Thank you. Any questions for these 2 witnesses?
I do have one.
Delegate Taveras and Delegate Johnson.
Thank you. Thank you, Madam Chair. I have a quick question. How do you define incest
Who can take that question?
in this bill?
I'm sorry, can you repeat the question? Was that, how is incest defined?
Yes, sir.
Yeah, I mean, without the sponsor here, I don't know that we can answer that question for the bill sponsor. I don't think that is defined, other than referring to what it would normally be in the Maryland statutes, Maryland code.
Okay. Delegate Johnson.
Thank you, Madam Chairman, and thank you for coming to testify. You just said that the FDA reluctantly approved. The FDA's job is to approve or not approve based on the evidence and the science that they get. So can you tell us what you meant by reluctantly approved?
Absolutely, Delegate. So right now, there is a pending lawsuit. We're waiting for the decision. Alliance Defending Freedom and a large group of medical physicians, including American Association of Pro-Life Obstetricians and Gynecologists, are suing because the FDA curtailed or shortened, abbreviated their normal standards of review to approve the use of mifepristone. So when it was originally approved, again, the FDA was not in support of it. But if you understand, you know, the FDA and several other executive branch departments are kind of political footballs, and they change with the whims of whatever the political administration is. So that has been the case with the Biden administration, who had made some campaign promises to remove any type of regulations on the use of chemical abortion pills. They call it regulations. We call it safeguards. And the FDA had actually put these remediation standards to reduce the risk of injury and death to women in place when they first approved the limited, very limited use of mifepristone. So the Biden administration politically pressured them to remove those safeguards. They did it reluctantly. They actually have a letter on their homepage about this issue to say that they still feel that the remote prescription and distribution of chemical abortion pills is not in the interest of women's health. So they're doing this, they're doing it reluctantly, and I think restoring, at least at the state level, we can at the state level restore those safeguards for women in law, and we would hope that you would consider doing that.
Sure.
Can you tell me when the FDA approved the abortion pills?
I don't know the year off the top of my head without my notes, but I know that it was originally, I think the Clinton administration, it was expanded under the Biden administration. Now those safeguards have been removed in the, I'm sorry, it was Obama administration and expanded in the Biden administration.
So it's been how many years?
I can't tell you off of the top of my head, again, what that first date that it was approved. But again, in just the first 10 years after they initially approved it, the emergency room visits increased by 500%.
So at least 10 years.
It's been over 10 years.
Thank you.
Yes.
Thank you, Madam Chair.
Okay, thank you very much. Are there any questions? Thank you. Thank you for your testimony today. We have two more witnesses, Ms. Faith and Ms. Pimentel. Will you please have a seat?
Good
Please
evening.
get started.
Thank you. Good evening, Madam Chair, Madam Vice Chair, members of the committee. Thank you once again for allowing me the opportunity to testify in support of this bill. My name is Danielle Pimentel with Americans United for Life. Ultrasound provisions both promote the health and physical and psychological health of women, as well as advance the state's important interest in protecting life. Ultrasounds are the only method, as you've heard from testimony today, in diagnosing ectopic pregnancies, which if left undiagnosed, can result in infertility or even fatalities. An ultrasound also enables a healthcare provider to more accurately date the gestational age of the child, and this is important because it ensures that the necessary abortion procedure is performed and provides also the relevant information necessary to make an informed decision, since the risks of abortion increase as gestational age increases. A 24-hour reflection period, which is within this bill, would ensure also that women have the time that they need to make a decision without the pressure of having to make an immediate decision, since medical, emotional, and psychological consequences of abortion are serious and can be lasting. 29 other states have some form of reflection period ranging from 18 hours to 72 hours. This bill would also provide women with the option to see her unborn child and to hear the heartbeat if she would like. Allowing women the opportunity to view her ultrasound and hear the heartbeat ensure an informed choice, because it gives the woman the option to see her unborn child as he or she really is by seeing his or her form, his or her face on the screen, and by hearing his or her heartbeat. Medical evidence indicates that women feel bonded to their children after seeing them on an ultrasound, and once that bond is established, researchers argue that women no longer feel ambivalent toward their pregnancy and, in fact, start to feel invested in their preborn children. So by giving every woman the choice to view her ultrasound if she so chooses and to hear the heartbeat, the state's furthering its interest in protecting life, as many women will ultimately decide to carry their children to term. Thank you so much. I urge your support of this bill.
Thank you. Next, please.
Thank you, Madam Chair. Again, my name is Johanna Faith, and as some of our other amazing Students for Life Action members have testified, we support HB 973 because waiting periods and ultrasound requirements allow women the opportunity to view the scientific reality of life in the womb. More than 25 states agree on this issue and have adopted similar waiting period laws and ultrasound provisions. National polls have also shown that the majority of Americans support measures such as these. A Gallup poll found that more than 85% of Americans favored informed consent laws and more than 70% favored waiting periods. This is because the 24-hour waiting periods in this bill allow women time to weigh their decision, assess risks and benefits, as well as alternatives. As this time allows for thoughtful consideration, it decreases a woman's chance of regret and increases the best possible outcome for physical and emotional well-being. Additionally, in an amicus brief before the Supreme Court, Focus on the Family discussed presenting ultrasounds to expectant mothers who were considering abortion in Indiana. And their data is really astounding. It shows that out of 861 women who received counseling at the specific pregnancy centers and elected to undergo ultrasounds, 97% of these women chose life for their children. So in other words, when women are shown the truth about the babies growing inside their wombs before undergoing an abortion, they decide overwhelmingly not to end the lives of their preborn daughters and sons. Regardless of your personal views, Maryland women deserve all the resources available to them in order to be truly informed of their pregnancies. And this bill provides that. And so we strongly ask you to give a favorable report on HB 973. Thank you so much.
Thank you for your testimony. We really appreciate it. Are there any questions for these two witnesses? Seeing none, thank you for being with us today. We really appreciate it. And thank you for being patient. And this actually concludes the bill hearing on House Bill 973. You have a blessed evening. Thank you very much. For the committee, if you could stay seated for a minute. Delegate Alston, can you wait till we're done? Thank you. What is it? Oh, for the students, excuse me, there is a message for the students. Can you hold on a minute? 1 second, go ahead.
I saw you all were trying to take pictures. I sent pictures to the bill sponsor, Delegate McComas, so you can get copies from her if you want them.
Thank you so much.
You're welcome.
Okay, thank you. That's very nice. Very sweet. Okay. So for the weekly review, members, we're going to meet now and do that. That would be great. Delegate Kipke will reach him and the subcommittee chairs as well. Tomorrow, I believe we're voting at 9 a.m. Am I right? 9 a.m. in this room. We'll meet during the day. As you know, it's going to be a long day tomorrow, so we'll be on and off the floor and voting, coming back, subcommittee. You know how that goes, right? Like if a ping pong, that's how we'll be tomorrow. So bring comfortable shoes, stuff to eat. Hopefully we'll have a beautiful day like we did today as well. For those of you that have not given Michelle the money, there's 6 people. You won't be named. We don't do that here, but you know who you are. We won't be shaming anyone because this is for fun. Please send her the money, and you could do Venmo, Cash App, Cash, Check, and PayPal as well. And we'll be here on Saturday. I don't know, there's some subcommittees tomorrow. We may be voting on Saturday. And also pay attention to the floor for the times that we give you, also to your email and your phones, because Michelle is very good about communicating with us. And then finally, there may be an instance or two where we need to take you off the floor, go on to the silver room, which is the room when you leave to the right for voting, so that we don't have to come all the way here, and our wonderful LAs will meet us there. So be ready for that as well, okay? And it is 8:04. I hope you get to rest a little bit. Those of you that do not have meetings tonight. There's food. I want to thank, it was Delegate Morgan, Johnson, and Kipke. Thank you for the food. I really appreciate it. And Delegate Chisholm, I went to your office to see you, to thank you for the wonderful gift you gave me. And I will be willing to share it if you want to come by my office.
I was
I'm not
gonna-
going to
no.
tell you what it is. Not going to tell you. Not going to tell you what it is, but you're more than welcome to come by quietly if you like some.
And if you remember my speech on the floor today, sometimes things are encouraged, sometimes things are discouraged. I would encourage you to go see what you got.
Yeah. I just want to say thank you. That made my day. Have a wonderful evening, everyone.
Don't forget your purse.
I know, I always leave it, and then
It matches.
I go to the hotel, and I leave it, and I run like crazy, and I find it, I'm like, oh, is it? I want to thank you for being here.
Yes, I just wanted to make sure before I leave.
No, we're fine. And can we thank our state trooper?